Okay, this is pec major, right? You see how it is? So if it has two heads, where it goes and attached to?
Sternal, clavicle, and the humeral.
Where in humerus?
It's like right.
The tubercle, the
Yeah,
upper tubercle.
yeah, tubercle. Yeah,
You know there's a lip, right? There's
yeah,
two,
yeah. The tubercle.
right?
Yeah.
One of those. So what is the main function of pec majors?
Adduction and medial rotation
Flexion.
Medial rotation of what?
of the humerus.
Arm, right? So if you contract this one, look, if you can touch it yourself, that's how I learned it. Whenever I contracted my pec, my hands automatically turned it. So this is the internal rotations, right? So it also does, if I do this, so it's gonna bring down, right?
I would like to do that in the exam. Like
You do whatever you wanna do as long as you know.
whatever.
As long as you know the
Everybody just
structure.
start doing the action
Yes.
right then and there.
All right, good. So you know what's the nerve supply, the pec major.
The
Yeah,
medial and
the medial lateral
lateral.
pectoralis nerves.
What's the blood supply?
Pectoral branch of the thoracoacromial trunk and the lateral thoracic artery.
Right.
Damn.
Yeah, shit.
Well, I'm gonna have to study that.
What?
That's all you need to know.
That's all we need to know.
Yeah. So if we say secondary question, if you have injury to lateral pectoral nerve, right? Now you know that pec minor is also innervated by one of those nerves,
Yeah.
right? So you have to figure it out which nerve is he's talking about. Whether he's just talking about which one, lateral, medial, right?
The medial.
Medial pectoral nerve versus lateral pectoral nerve.
So it's medial and lateral for pectoral major, but for minor it's just medial. Right.
Which one is for minor? Medial is
Minor,
pectoral?
Minor is just medial,
Medial
and
pectoral,
major
okay.
is.
If he's
both.
talking about so you're
minor.
gonna have two different things, right? You're
Yeah.
gonna have an injury to your pec major, partial injury,
Mhm.
partial paralysis of your pec major, and complete paralysis of your pec minor.
Mhm.
So now, if he's just talking about the medial pectoral nerve, if he's talking about the medial and lateral pectoral nerve, so you're gonna have both muscles abolished. You're gonna have a pec major and pec minor, right? If he's just talking about only lateral pectoral nerve,
Then you know it's just the
so it's
major.
just the pec major part just supplied by that. So you're just gonna say, oh, it's an impairment, you know. It's not complete loss. It's just an impairment in the functions of the pec majors. So that's all you need to know. So if we say if you have an injury to these muscles, what gonna be that? If you have an injury to this nerve, what functions you're going to lose it? So you know that pec major does, internal rotation and adduction, right? So you're gonna know that if you have an injury to that, you're not gonna be able to do this one. So now you need to know. That's how we learn it. We made a box, the major adductors of your upper extremities. So I put all those muscles in that. All right.
Okay.
So I know if it's one muscle does adduction, whether the multiple muscle does adductions. So if we complete loss of adduction, whether it's a partial loss of adduction. So that's how you guys gonna know. Okay.
Do we have to write it like that?
Yeah, I mean that's how I studied. That's how I
The
studied.
left and right we have to specify.
Yeah,
Which one
no, of course. Because if it is on the right, it should be on the left. If it is, bilaterally. All right. What's the function of pec minors?
It doesn't keep the scapula in place or whatever.
Yeah,
Yeah.
because it's going to attach to your which area?
Coracoid process.
Coracoid process of the scapula. So it keep the scapula against the rib cage.
But also doesn't it do protraction as well?
Yeah, not too much, but most
both
thing
are really tall.
is depress the scapula against the rib cage. So
That's
like
the serratus.
no,
That's the pectoralis minor.
pec minors. You guys know you have the book, it should be there. I'm just giving you the examples, I mean that's how you should know it. So if you have the injury to that nerve that supplies pec minor, so what kind of sign and symptoms you're gonna see in the patients, right? So you can do this one. Your scapula not gonna be depressed against your ribs, so it's gonna be a little bit off. So you can see that one. Same thing with the long thoracic nerve. I'm just giving an example, right? Supplies to your serratus inferior muscles. Serratus inferior does what? Keep also depress your scapula
Scapula.
against the rib cage.
Yeah.
So if you have long thoracic nerve injury, so you're gonna you can't keep it anymore. So you see now there's two different muscles that does the same thing. So you're not gonna be complete lost, right? There will be a
So could we say it's a partial wing scapula then?
yes. You can do that one. You can just wing scapula. You know.
But in case it's say if it's just long thoracic nerve, not the pectoralis nerve, then you would say partial wing
Yeah, I
scapula.
mean you're gonna go and look for the function. I'm not. Don't quote me on those things, but just saying you that go look for functions, specific function, and go look for the nerve injury where you guys have it.
So, Ms.
Okay.
Todd, so you're saying that if it's a damaged long thoracic nerve, then it's automatically wings scapula.
Yeah.
But if he says the damage to the medial nerve, then you know it's a partial.
Partials, yeah.
For the
So you guys gonna differentiate it between them, which is the major one. Then again, you're gonna look for what's the major, what's the minor. What's the major function, which muscle has the major function versus which muscle has the minor functions. So if you say serratus injury have a major function to keep depress the scapula against the rib cage, so that's the major one, you know. And pec minor is a minor one, you know, it's not having a major function on the scapula. Yes, go ahead.
What if two muscles have the same function and one of them is paralyzed?
Yeah, so you have an impairment. You're not gonna complete loss of that muscles, right? If one muscle, you mean one muscle is innervated by two nerves, or one muscle have the same functions?
Same function.
Two different muscles have the same function. So you're gonna have a not complete loss, right? You're gonna
So
have
partial.
that lost particular muscles, but the other muscle does the same thing for you. So you're gonna have not complete loss of functions.
So
You're gonna have
partial
a
loss.
partial loss of functions
Partial.
versus complete loss of that muscle's functions, right? That muscle function is completely lost, but not complete loss of the whole function as a unit, you know, because one muscle, there's a 2 or 3 different muscles does the same job, right? So you're gonna have loss of function impairment. They can cut it. Let's see. Pec minor.
Okay.
Take up the pec major from here. There you go. You see subclavius?
Yeah.
It's very deep down, you know, because
It's
since
right
we had
underneath.
cut it, because we cut the clavicle to pull the rib cage up, right?
Yeah.
So that's why it's a little mess up there. So when we're gonna go more deeper, that
It'll be
time I'll
there.
show you guys exactly where the subclavius is. The main function of subclavius is pull it down, your clavicle. That's the major function is. And what's the nerve supply to subclavius? Yeah, nerve to subclavius. That's how you're gonna know that. That's a stupid question, and you have to do it. You have to do it. Okay, this is your pec minor, right? You see where it started? Your serratus anterior, right?
The angle of the ribs.
The angle of the ribs. You see where the ribs? This is not part of the ribs. Ribs end up here. This is costocartilage.
Yeah.
So if we sometimes it's very tricky. He say, "Oh, rib directly attached to the sternum." No, rib does not attach directly to the sternum. It's the costocartilage that attaches to the sternum, and the rib attached to the costocartilage. Okay. So this is your serratus anterior. Let's see. And look where it goes. It comes right underneath the. It's right underneath the scapula. You see? Can you see those? Okay, let's finish this one. Let's go to the intercostal so we can see them. Pec major, pec minors, subclavius also take it off. Somebody's having their hands here. Okay.
The only issue is that when you try to zoom in, you don't really get to see the fiber directionality.
Yeah. You don't. I don't think that he's gonna show you the muscles. Muscles gonna be up there.
So muscles there.
Yeah, he might gonna go on the table too. I don't know which way he's gonna go. But in both cases, you know where those muscles are located.
So basically, with both the table and the cadaver, he's going to ask the same kind of questions, really.
I don't know if you're gonna ask the same question. Maybe it's a
might
couple
just
of
ask
questions over
whatever you
there, a
can
couple
ask
of
over
questions
here.
over here.
Yeah.
So
sure.
be ready for both cases, you know. So you know the direction of your muscle fibers, right? What's the direction?
Hands in the pocket for external.
External intercostals.
And then
Right.
and internals upwards at
Upward
a.
is
Like this. Hands on the breast, right? Yeah.
But I'm pretty sure he would want us to write downward, forward.
No.
So
He's just
you
telling
can
you.
write hands in the pocket?
No, you cannot.
Okay.
Just to identify.
You just
He's
learn
not
it.
gonna ask you the direction. He's gonna point at it, and you just
You're
label
gonna say,
what it
okay,
is.
what is this? You're gonna say, oh, it's external intercostals. Or what is this? Is it the internal intercostals? Or what's the nerve supply? What's
For the bands.
yeah, I mean those are the intercostal segmental nerve, right? Segmental intercostal nerves. Same with the arteries and veins, where they originated. Those things. And the innermost intercostals, that's the deepest one, right? Yeah, the vein is running between internal intercostal and innermost intercostals, right? So remember those ones. So let's go to the back and see.
Move it from the head to it, yeah.
what muscle is this one?
Can I? No.
Attached to this oxygen.
Can we not move this way a little bit? Man.
Oh, what if we press this?
Use one
Press
of these.
this.
Could you use one of these and then flip it? Like, no, not that one. Try to.
No, this is good.
That's good. There you go. All right, guys.
What is that?
Here you go.
Trapezius.
Trapezius.
We have to see
That's
those.
trapezius, but this one is also trapezius.
We have to see those long muscles too in the back. The one is
Erector
iliocrosis.
spinae?
Yeah. Laryngismus spinalis, transverse spinalis, and pec major. Pec major is different. Rectus spinae. Iliocostalis and lumborum, laryngismus dorsi, and semis.
He told me he has a bit of
Like what I was trying to ask him in the room is he won't ask specifically if it's longus thoracis or if it's longus or
It's the name says it. Iliocostalis lumborum definitely is going to be in the lumbar regions.
You got real?
I start from your ilium. Everything makes sense. Iliocostalis start from the ilium, goes to the ribs. Lumborum